Yeah, just a quick review of the Meiddano Copper Knee Brace. So this knee brace, I really would rather call it a knee sleeve because braces are usually a little more rigid. A lot of them, have rigid materials like maybe say metal, metal joints and stuff. I think it's more like a knee sleeve. But anyway, nonetheless, this sleeve is specifically made for people that have knee pain or a knee problem. So the idea here is that you put on the sleeve and it supports the joint and surrounding soft tissues, restricts the motion a little bit in the knee, which gives it stability. So that way your knee has a chance to rest, recover, and not so get stressed out as you're doing things. So a few points about this particular brace. This one is different than a lot of knee sleeves, basically because it has this elastic strap on the front here, as you can see. So that gives you a little extra support above the knee if you feel like you need it. Sometimes compressing here kind of, influences your kneecap, but also it'll help the brace stay up. So you don't really have to worry about this one sliding down very much on you. The other thing is it is made of a nylon, which I really like because nylon is a very durable fabric. So that means this brace is probably going to wear well over time and last a long time. Knee braces, put them on. The only problem is if you have a long-term condition, like arthritis, for instance, there's very little carryover if you take the brace off or the sleeve off, either one. So there are some other things actually you can do for your knee to get that long-term carryover, meaning less pain and get you where you want to be. For example, I'm getting this from Bulletproof Your Knee. Strengthening your quadriceps muscle. So basically, just about any problem you can name with your knee, I can probably show you a study showing that there's a problem with your quadriceps muscle. So for some reason, all the muscles around the knee, the quadriceps gets affected. So when you have, for instance, say, it's knee swelling, if you put enough, there's studies actually where they inject the knee, researchers will inject somebody's knee with fluid, and once they reach a certain point of fluid, which is like duplicating swelling, the whole quadricep muscle just basically shuts down, and you can't even lift your leg off the table. So here again, it selectively inhibits your quadriceps muscle, which is interesting. If you have any knee swelling, knee injuries, people that have knee injuries, things like removal of knee cartilage, fractured tibia, all kinds of stuff. They find, hey, these people also have problems with their quadriceps muscle in particular, not really much with the other muscles around the knee. Ligament problems in the quadriceps, a lot of research on people with like ACL, anterior cruciate ligament problems. They look at, they take people with like ACL tears that ruptured it. They look at the strength of their quadriceps muscle. It's weak. So here again, the quadriceps muscle is either weak or it's just a lot smaller than normal when they do things like cross-sectional scans on CT. Posterior cruciate ligament, medial collateral ligament, having knee pain, knee arthritis, all takes its toll on your quadriceps specifically. So definitely have to get that muscle stronger. So there's some exercises here. Fine-tune control over your knee. Sometimes the problem isn't just at the knee. Sometimes your knee problem is actually caused by problems up at the hip. So the hip does help control the knee. So if you have problems with your knee, with your hip muscles, like say being weak, it could definitely affect your knee. For instance, if you have like iliotibial band syndrome, there's a lot of studies taking people with iliotibial band syndrome and they test their hip abductors, and that's hip abduction. The muscles that are responsible for that are your abductors, bringing your leg away from your body. They find that, hey, people with ITB, iliotibial band syndrome, have decreased their strength in their hip abductors. Likewise, there's studies showing that if you increase the strength of your hip abductors, iliotibial band syndrome goes away. So it's just not really any joke. Knee flexibility, of course, your knee has to be flexible, but your knee does more than just bend and straighten. It actually rotates out to the side. About the last 15 degrees or so of you extending your knee, straightening it, your tibia actually rotates out to the side laterally. So that's an accessory motion you have to have really to have full function. So some stretches will take care of that. And the last thing you can think about doing is, let's see here, knee stability. Let's see here, what are they calling it? Oh, increased knee stability. So basically, you're talking about proprioception here. Proprioception is your position sense. So like if I suddenly turn off the lights now, you'd be able to tell me, most people, if your knee is straight or if it's bent, okay? And that's because your proprioception, that's your position sets. The receptors in your joint are giving you feedback, to your brain, telling you exactly where it's at. Well, they find that people that have knee problems, their proprioception isn't really what it's supposed to be. So actually, that's something that you can change and improve. So yeah, lots of other things you can do. Nothing is quite as quick as putting on a brace. That usually gives instant pain relief for a lot of people. Problem is, it doesn't give you long-term carryover, but sometimes you need that extra stability and to prevent future injury. So yeah, this is a good knee sleeve. So check it out.